Okay, so we are now recording. My name is Dr. Alicia Shadaman. I'm the director of the Center for Nonprofit and NGO Studies here at Northern Illinois University. We have an undergraduate degree in nonprofit and NGO studies. We've been around about 11 years. This is our 12th year. And we connect nonprofits with our students through internships, service, and research, and provide capacity building and thought leadership to nonprofits across Northern Illinois. I'd like to welcome you all to this webinar on rethinking how we think about hunger and the role of food banks and food pantries. And I'm delighted that so many of you have joined us today. In fact, I think this is the highest enrolled webinar we've ever had since we've been doing this for about 1.5 years now. So I'm delighted that you're here. I ask you if you want to turn your camera on so we can see you, not required, but sometimes that's nice for a speaker to see some folks. All of the mics are muted at this time because we do expect probably over 60 people. If you do have questions, you can put those in the chat, and we're going to try to leave time for Q&A at the end of the session. And I'm going to turn on live transcription because sometimes that is useful to folks. And if you don't need that, you are able to turn that off also on your end. I also want to thank our co-sponsor of this event, the Dekalb County Community Gardens. Many of you are here from that organization. They're a local nonprofit that empowers people to choose healthy and sustainable foods through education and participation. Founded shortly after the center in 2012 and growing mightily ever since. So I want to put a quick poll up just so we can see who else might be in the room. So let's go to here. If you want to let us know where you're joining us from today. So are you in Illinois, outside of Illinois, or outside of the US? Let's see how far away some folks are coming in from. I'll wait till we get up to about 80%. There we go. And so most of us are coming from Illinois today, although we do have a few coming from out of state. So welcome to all of you for coming out of state. Great. I read a lot of books. Actually, I have probably too many on my desk right now. I'm always reading a couple at the same time, both for teaching and for fun, so fiction, nonfiction. Dr. Katie Martin's book called Reinventing Food Banks and Pantries is fascinating, compelling. If you have read it, you probably couldn't put it down. I love all the evaluation stuff, Katie, which I know you're going to get into. I reached out to Katie last spring and asked her if she'd be interested in sharing some of her thoughts and insights. And she very quickly replied yes, which was great. So we're delighted to welcome her to our nonprofit community in Northern Illinois, at least virtually for now. She has over 25 years of experience in anti-hunger work. She received her BA in political science from Indiana and a master's and PhD in nutrition science and policy from Tufts University. She's been engaged in research throughout her career, trying to better understand hunger, its causes, and possible solutions. She's also taught at the University of Connecticut and the University of St. Joseph, and she is now the executive director of the Food Share Institute for Hunger Research and Solutions. So welcome, Katie, and thank you so much for joining us. I will turn the reins over to you.
Hi, everybody. Thank you, Alicia. And I'll let you know, I was actually born in Evanston, Illinois. So I'm Illinois at heart, and definitely a Midwesterner by upbringing. So I'm thrilled to be here with all of you. And hi, Diane. I see you're in the text box. So I'm going to share some slides and we'll go through, I'll do kind of a formal presentation at the beginning, but by formal meaning, please chime in, take yourself off mute, put a question in. It's much more fun to do this as a dialogue. And then we'll pivot and have more time for Q&A and more discussion. So if there's something that is, you're thinking about in the moment, don't feel like you have to wait until the end. And I also just want to give a really big shout out at the beginning to folks from Northern Illinois Food Bank. I've had the pleasure of getting to know some of the team there, including fantastic leadership by Julie Yurko. Jen Lamplow is an amazing colleague. And I just responded to an email this morning from Chelsea Corin, who's doing some cool work with some local pantries. So thanks for all that you do. And let's see if I can share my screen. And hopefully we can do this. Hold on a sec. Can you see that as full screen?
Yeah, that looks good, King.
Awesome. So very excited to be here with you all. I work in Connecticut at the newly merged food bank called Connecticut Food Share. We had been 2 food banks. We are now merged as one, serving the state. And I direct our Institute for Hunger Research and Solutions. And as Alicia mentioned, I'm proud to talk about this book that was published in March. If you're not familiar, it's called Reinventing Food Banks and Pantries. And what's really exciting in the last 6 months is hearing from colleagues in food banks and food pantries throughout the United States, but also internationally, who are reading the book, telling me about the impact that it's had and the types of changes that they're making to reinvent the way that they think about hunger and the work that they do. It just warms my heart and soul to see the impact that this is having. So if you haven't picked up my book yet, I would encourage you to do so. You can go to Island Press, is my publisher. You can also go on Amazon. It's an ebook. It's also an Audible. I know my husband doesn't read many books anymore. He just listens to them. So if you like it on Audible, that's fine too. And then tell me what you think. Like, it's really, really helpful to know what resonates with you all. And I'm hoping we can have that kind of dialogue today. So one of the common questions that I get about the book is, what was my motivation? Why did I choose to write the book? So after graduating from Indiana University, I had an internship in Washington, D.C. with my congressman from Dayton, Ohio. And I became really passionate and interested and concerned about the issue of hunger in our wealthy society of the United States of America. Right after college, I interned at the food bank for New York City. And it was my job to monitor the food pantries and meal programs that receive food from the food bank to make sure that, you know, they had food safety regulations, et cetera. At the beginning of the book, I describe this scene. That's the picture on the left. This is in Lower Manhattan. I had just come off the subway. It was a beautiful Friday morning. And as I approached the food pantry, this is what I saw. There were a line of people who were lined up, and they were, the whole line snaked way down the sidewalk. And the people would slowly move towards the front of the line. And if you've been in Manhattan, you can see these brown houses, and in many urban settings, the food pantry was located in the basement. The volunteers had pre-bagged the food, and they would hand the bags one to the next, up the steps, onto the sidewalk, and hand it to the next person in line. And I can tell you, from my experience visiting food pantries, it's very common that people who received that food were very grateful for the food. They needed that food today. But it struck me that there must be a better way to tackle the problem of food insecurity in our wealthy, innovative country. And over the course of my career, I've spent a lot of time in food pantries and food banks, and I've seen some really amazing, innovative, awesome stuff happening. And yet, sadly, as you can see from this picture on the right, which was last spring during COVID, in many ways, we're still tackling this problem with some standard, people waiting in line, often too long waiting in line. You can see it disproportionately impacts people of color. And I wanted to share this work, the innovative things that I've seen, highlighting examples of what folks are doing around the country to inspire people to think differently about food insecurity, but most importantly, to spur action. So at the end of every chapter of the book, there are action steps that you can take in your community today. And my why I do the work that I do and why I wanted to write the book is primarily for the single mom, and often a single mom of color who is worried about having enough food for her kids at the end of the week, at the end of the month. And this beautiful photo is from Fresh Place, an innovative food pantry in Hartford, Connecticut. And I love everything about this. It's that the daughter who's smiling at the camera, she's shopping with her mom. There's a volunteer who is there to just support the mom and build a relationship with her. This is why I do this work and what drives me and inspires me to do the work that we do. I know many of you are probably very familiar with our charitable food system. It's fun to talk with academic audiences and other groups because I think there's a lot that folks don't always know about this massive charitable food system that we've created over the last 40 years in our country. Feeding America, which is based in Chicago, is the country's largest anti-hunger organization, and they oversee 200 regional food banks. According to Food Bank News, there are approximately 170 other regional food banks that are not part of Feeding America. And those food banks collect and distribute millions, billions of pounds to a network of over 60,000 food pantries that are in nearly every community, urban, rural, suburban, affluent, with generational poverty, communities all around our country. Millions of Americans rely on these food pantries and meal programs, typically not as an emergency, but more on a chronic basis. And what's important to note is that food pantries are part of our national and local food systems. I think they're often overlooked when we think about food insecurity, when we think about healthy food access. We often think about our grocery stores, school meal programs, even local corner stores, our federal food assistance programs that are the foundation of food assistance, our SNAP programs, school meals, WIC, et cetera. But I think we're remiss when we overlook the important contribution that food pantries and food banks can make in providing for healthy food and addressing root causes of hunger. One of our challenges within the charitable food system is the scarcity mentality. So when we think about the innovative, holistic work that we can do, I think we often hold ourselves back with this mentality of not having enough. And if we think about people who are struggling with food insecurity, it makes a lot of sense that people are focused on a lack of food, money, time, support, resources. When people are struggling to have enough food, they go through coping strategies as part of making ends meet. We did a statewide study recently around food access here in Connecticut. And some of the things, the coping strategies that we found were that almost half of the people we surveyed said they were buying cheaper food during the pandemic to make ends meet. We know that can lead to health disparities. Another coping strategy, a third of the people said they were stretching their food by eating less, right? So it makes sense at the individual level that people feel this lack. But unfortunately, we see it at our organizational levels as well. When I talk with food pantries and food banks about trying innovative approaches, getting out of our comfort zones, usually what I hear is we don't have enough food, money, time, volunteers, certainly space, equipment, et cetera. And because we know there's so much need right now, we want to focus on just providing food. And that limits our ability to reinvent ourselves, to think bigger. So our coping strategies are that we don't always plan for the future because we're focused on emergency provisions right now. And unfortunately, when we're focused on the scarcity mentality, we have a tendency not to evaluate our work. And we can do better. So one of the things that Alicia wanted me to hone in on in our discussion today is, why is there such a lack of evaluation of charitable food, right? So if we have this massive national network of food banks and food pantries that have evolved and grown over decades, we've been doing this work, many food banks since the early 1980s, some as early as the 1970s. And there's a dearth of evaluation and research that has been conducted. Thankfully, that's changing. But I highlight three key areas of why I think we have a lack of evaluation. The first is that we tend to think of our work in charitable food as an emergency response. And this was definitely true before the COVID pandemic, so that even before COVID, we would still in academic research articles and in the vernacular of how we talk about food banks and food pantries as emergency programs. And I scratch my head at this because when an emergency has lasted for decades, and we know that the people who are coming to receive food are doing so on a chronic basis, it is not an emergency response. It is not an emergency program. But when you have an emergency, when I think of an emergency, think of more like a natural disaster. When there's a hurricane, when there's a tornado, we've certainly seen a lot of those with climate change. When you have an emergency, you don't evaluate your response. You just make sure that you bring resources as quickly as possible to as many people as safely as possible, and you help them right in the moment. When we continue to think of ourselves as emergency, we're less likely to evaluate it. That's a shame, and we can do better. I think a second reason that we don't always evaluate the work of food pantries and food banks is because we think of this as inherently good. There are many, many people who benefit from providing charitable food, sorting charitable food, donating, providing, handing out bags of charitable food. And when we feel good about something, we sometimes don't want to look behind the layers, peel it back and say, but is it actually effective? Are we thinking strategically about this, and what impact is it having? So there are many organizations, corporations, donors, volunteer groups that benefit from this system, and therefore we don't always want to evaluate it. Again, we can do better. And the third reason I think we tend not to evaluate in a more rigorous way is that our key definition of success has been pounds of food, and the number of pounds of food that we distribute to X number of people over time. And historically, this has been our key metric. It's very easy to measure. And for years, we could show that that number consistently year over year went up. So it's impressive. We serve millions of people, billions of pounds of food. And for a long time, I think we felt very comfortable with that. Many donors felt comfortable and impressed with these large numbers showing our success. I'm seeing that changing a lot. Donors are becoming more sophisticated, and we working in food banks and food pantries are starting to question, how do we know that, what happens to those pounds of food? Is it having the impact that we think it is? So some of that is changing, and I'm excited about some of the new trends that are happening to not only measure the pounds of food, but the nutritional quality of those pounds, and looking at some other key metrics like financial well-being of the people we serve and other measures of success. And I'll get into some more details on that. So this is in many ways the paradigm shift that I highlight in the book, that I promote in my work, and through our Institute for Hunger Research and Solutions. We provide resources and trainings to help build the capacity of food programs to more effectively address the root causes of why someone is struggling with hunger and food insecurity in the first place. What's bringing them to that charitable food program? How do we help them? How do we measure that success? And we've coined this as part of our 3 C's. And we build the capacity of programs to create a culture that is welcoming and empowering and dignified, to reduce the stigma of asking for help. A core component of this is around choice, allowing people the dignity to choose their food. And we hosted a webinar recently, and Jen Lamplaw from the Northern Illinois Food Bank was one of our key speakers, and she did an amazing job talking about how the Northern Illinois Food Bank is doing some really innovative work around choice, online options, and other ways to provide choice, even if it's not in a shopping environment in a traditional food pantry. And then our third C is around connection. How do we build relationships with the people we serve to make more of a connection one-on-one, to understand the issues that they're going through, and to help connect with other existing community resources to help them address those root causes of hunger. So those connections are at the individual level and at the organizational level. And the premise of all of this work, and one of my core beliefs, is that it takes more than food to end hunger. When we think about evaluation and doing this work, the way that we define a problem defines our solutions to that problem. So if we define the problem of hunger and food insecurity in the US as not having enough food, then our solution becomes quite simple and quite obvious. We should collect and distribute more food, right? That leads us to measuring outputs and focusing on pounds and meals and number of people. And the focus is on efficiency, right? There isn't enough food. Therefore, we want to very efficiently collect and distribute more food. We've done this really, really well over many decades. And not to minimize it, this is big, important work. And certainly during the COVID pandemic, there were many people who did not have enough food, and we needed to get it to them as efficiently and safely as possible. But I would encourage us to think, if we define the problem as a much more complex problem that is rooted in stagnant wages, underemployment, a lack of access to healthy, nutritious food, unaffordable healthcare, housing, childcare, lack of available transportation, and really digging into how food insecurity is rooted in systemic inequalities, structural racism. When we go into defining hunger in this more complex way, then our solutions have to become more complex also. Our solutions become more holistic and more coordinated. We can pay much more attention on systems level thinking and policy and advocacy, that it's not necessarily an individual's fault or that they just can't get food, but what are the policies and systems changes that need to take place so that people can afford the food that they need. This lends us to more collaborations, more partnerships. We can't do all this work alone. We, in the charitable food world and food security advocates, don't need to be experts in all of these things. We don't have to tackle all of these things alone. But if we recognize the more complex nature of this work, then we should be partnering with other existing agencies, organizations that are doing this work as well. We can focus on healthy, nutritious food, and most importantly, including those with lived experience to gather their stories, to gather their feedback, to gather what they think the solutions should look like in their community. And that can lead us to measuring longer-term outcomes. So I want to just give you a few examples of some research that we've conducted recently through our institute. In response to COVID, like many other food banks, here in Connecticut at Food Share, we created a drive-through distribution center. And what we found was, we did a survey back in May of 2020. 70% of the people said they had to choose between paying for food and paying other bills in the past month. Think of like that economic shock of how many people were living 1 or 2 paychecks away from being food insecure, and COVID tipped them over that edge. I'm a big fan of combining quantitative with qualitative data. So we gathered some nice quotes that we can share of, you can read this here. It's the economic insecurity and the anxiety and worry about how you're going to provide for your family. This is what food insecurity looks like. Demographically, you can see half of the people who were coming to our drive-through distribution had kids under age 18. We were serving predominantly Black and Hispanic households. And this is really a kicker when we think about who are we serving, who might we be missing. 70% of the people who were coming to this new drive-through said that they had never used a food pantry before COVID. We're serving new folks, new people. And I love this quote here that the coronavirus is taking away the stigma of getting help. I would encourage all of us, how do we leverage this to share these stories, to share these examples, to increase access so it's not so stigmatizing? So these were people who were receiving food from us. We also did a survey this past spring, 1 year into the pandemic, of a more representative sample of people in the state of Connecticut that we might not be serving, to understand where are the gaps, who are we missing. This was really, really important to look at. The majority of folks said they don't want to rely on a food pantry because they want to support themselves, that measure of pride, right? Half of people worry that they have too many assets to qualify. They don't know when food pantries are open. 42% said they would feel embarrassed to use a food pantry, or they were worried that others would find out if they use a food pantry. This is so important for us to know, right? How do we use this information to then reduce that barrier, make it more convenient, more appealing, more acceptable to receive help when folks need it? These are the kinds of things that I talk about in my book of the language that we use. We could start there, starting with really strength-based language, welcoming signage, the whole intake process of how people come in. How do we make that more welcoming, less stigmatizing? Even the name of the programs, if we think of this as charity and a food pantry, it might hinder people from wanting to get help. How do we rename this so it's more person-centered? Making sure that the language we use is reflective of the people we're serving. So much of this work also is focusing on improving the guest experience. So how do we put ourselves in the shoes of somebody who may be using a food pantry for the first time, or is experiencing food insecurity for the first time? Something simple like designating a greeter. Their only job is really there to greet someone with a name tag, to build relationships and make it. Think of the favorite places that you like to go to shop or go to eat. What does it feel like when you go into that store, that restaurant? How do we mimic that experience in the work that we're doing in our programs? Reducing the power dynamic between us and them, between guests, volunteers, staff, allowing some people who utilize your food program to participate as a volunteer so that we can break down barriers. There's a lot of great work happening on trauma-informed care and recognizing how many people we serve have likely experienced trauma, and using that to improve the guest experience. How do we promote health equity? Certainly during COVID, we know there are drastic health disparities that exist in our country. They were made worse by COVID-19. If you're struggling with food insecurity, you're often very likely to also have comorbidities of type 2 diabetes, hypertension, obesity. We have a stoplight system called SWAP, which stands for Supporting Wellness at Pantries, that ranks food nutritionally into green, yellow, and red based on saturated fat, sodium, and added sugars. And we recently revised the SWAP system to align with some new national guidelines from Healthy Eating Research, which is a program of the Robert Wood Johnson Foundation. And the new Healthy Eating Research guidelines have been adopted by Feeding America, and they are encouraging food banks and food pantries to use these same guidelines. There's a lot of innovation that can take place to create healthy nudges using behavioral economics to nudge healthy behaviors in our charitable food settings. We can also many innovative ways to address root causes of hunger. So again, thinking of how do we design food pantry settings to provide wraparound services, having resource centers in addition to the food with additional community referrals, hopefully moving towards warm referrals where instead of just having a flyer or a brochure, you have a volunteer or staff member who's knowledgeable about those community organizations, opportunities to assist people and do some follow-up to make sure that that referral was effective. And again, this doesn't mean that you have to do all this alone. Can you invite other community organizations to come to your food program, to tell guests about your service, their services, to enroll people in services? This can take the form of healthcare providers, workforce development, employment opportunities, nutrition education, many different ways to think outside of the box. When we engage with folks to understand the root causes that they're struggling with, this is where it creates that launch pad for bigger advocacy and systems change, because you can identify what are the common barriers that people have? What are their common dreams and aspirations for getting ahead that are limited in your community? And how do you advocate for bigger change? So some of the key themes in my book and in my work is that for sure, we're doing very good work to tackle the problem of hunger, but we can do better. We can dream bigger and aim higher. And if ever there was an opportunity to think differently about how we approach this work, it is definitely in response to this pandemic and the racial awakening that we've seen around the country to tackle these disparities of food insecurity in our community, so that we can move from a mindset of providing charity to supporting justice, moving from simply pounds of food to the quality of that food, shifting from an emergency mindset that is short-term and more Band-Aid approaches to empowerment and helping our individuals and our organizations to address longer-term solutions so that we're less focused on transactions and more on transformational change. If you're not familiar with our institute, again, we serve as a resource for the charitable food system of food banks, food pantries, other academic partners, community programs. We have 4 key goals to increase access to healthy food. We do that primarily through our SWAP system, address root causes of hunger by offering more than food. We identify best practices. We do that through research and evaluation. And my favorite part is that we promote a paradigm shift towards longer-term solutions to hunger. If you're interested to learn more about this, I would encourage you to sign up, subscribe to our institute at foodshare.org/institute. You can sign up. We have monthly newsletters and monthly webinars, and hopefully we'll see you on a future webinar. And then here's all my contact information for the institute. We are now more active on social media, so hopefully you can follow us and like us at Hunger Institute and tag us and show us the great work that you are doing in your communities. And there's my email as well. So I am gonna stop sharing and then pass it back to Alicia. So hopefully we can have a more in-depth conversation.
Thank you, Katie, so much. I read the book and I still learn a lot of things, even just by you going through the highlights. When we were chatting back and forth, I said, well, Katie, I have a ton of questions because you're here and this is a captive audience. So we should be able to have good conversation. So if you do have questions for Katie, you can put it in the chat. I can also unmute you if you just want to say, I have a question, just type that into the chat. I thought it would be useful to kind of talk about, because of your expansive role in studying this across the country, how do you think the role of nonprofits and nonprofit food banks, as well as pantries, how do they integrate, or do they integrate with other government food programs? Like, you talk about it being part of the system. Government is a huge part of that system. How is that integrated, or is it integrated as it exists?
Yeah, it's a great question. So absolutely, our federal food assistance programs, starting with SNAP and then school meals, WIC, et cetera, they are the first line of defense against hunger. And most of our federal food assistance programs were created in the 1960s as the war against poverty, and in the early 1970s. There's tremendous research that they work, that they are effective. Yet we know participation rates in some federal food assistance programs are fairly low. We need to do more outreach. Not everyone who is food insecure is eligible for the federal food assistance programs, but absolutely that is the first line of defense. It's interesting, food banks, historically, there were many, many years when there was a disconnect between the public federal food assistance programs and private charitable response. Thankfully, most food banks now around the country do SNAP outreach. So there is definitely an emphasis on ensuring that folks know about SNAP, know how to enroll in SNAP. It's exciting to me to see that start to expand, that I'm seeing more food banks talk about benefits outreach. So it's not just SNAP, but other benefits as well, including the Earned Income Tax Credit, EITC, or outreach for health insurance and the Affordable Care Act. Like, as we expand in that role, to know we can't food bank our way out of solving the issue of hunger. We should be advocating for people to take full advantage of the federal food assistance programs. But again, there are many, many people who are over the income thresholds and may not be eligible for public food assistance, and that's where we can fill the gaps. So I think tons of partnership opportunities there. And looks like Shannon, I will make the slides available. I'll send those to Alicia, and then hopefully you can send those out to everybody.
Yeah, I'll send it out with the letter. Yep, no problem.
Right.
What do you, because a lot of the food pantries and food banks rely on donors, either large donors, foundations, corporations, as you mentioned, and other individuals that support these. What are things you wish, if you had a group of funders sitting in a room, what do you wish that they understood better about food banks and food pantries? And because and you mentioned a couple of them, why they might engage, why they shouldn't, whatever. What do you wish these funders understood more about this work, and why they need to be supported?
Yeah, so I think understanding the history of how we got here, and I think the more that we can shed light on the evidence and the research and basing our work on that is so important. So again, the metrics of delivering pounds of food, if that is our key metric, we're going to be stuck in that mindset. For donors to recognize more of the systemic inequalities and the other barriers that are in place, and how, if a funder has been comfortable with providing X amount of dollars to help pay for food, as they become more knowledgeable about these underlying root causes, I would love to see them say, could we also help support resource centers and computers at food pantries to help connect people, like other software programs, staffing to support coaching, and navigators to help connect people to other resources. So thinking beyond food. So part of that, I think, is our responsibility of food banks and food pantries to make that really clear to our donors, and then for donors to see that broader scope of what we could do.
So Michelle asked a question, how does the US compare to other first world countries in this area? Is the US doing better or worse than some other countries, and maybe thoughts on why?
So it's very interesting. I wrote this completely from a US context, right? This is all about the charitable food system and the federal food assistance programs here in the United States. And I think that, it's been intriguing to me to hear from the food bank networks in Canada, in the UK, in the Bahamas, and in Japan, that the messages from the book resonate with folks internationally. I think that many industrialized countries do not have the same federal food assistance programs that we do. They often have much more generous government supports of things like healthcare and education, and so they fund other social supports in more generous ways than we do in the United States. And many industrialized nations are they're mirroring what we have done with our charitable food network. So they have built these food banking systems like we have, just later than we have. So I'm hopeful that in many ways they can learn from some of our history and more of the innovative stuff that some food banks are starting to do now that we weren't doing when we started these programs.
So Ashley asked a good question around, if your food pantry has limited space, what should you prioritize? I know many food banks or food pantries, when they first start, it's, as you said, a basement in a church or a side, office space that somebody's graciously donated. But on limited space, where do you think they should concentrate their efforts?
Yeah, it's the most common concern that I hear. We just don't have enough space. I think truly any space can offer some amount of client choice or allowing people to choose their food. That typically is the biggest concern that folks have. We can't offer choice because we don't have space. From my experience, and I write about this in the book, there's 100% track record that when people shift to client choice, it is just a better way to offer food. And even in very small spaces, you can do that. I think it also, one of the things that I find as you move along the continuum of thinking more holistically, thinking broader about the role and the impact of your food pantry, I would encourage you to think about your space. Where are you housed, right? Is it within a church setting? Is it in a community organization? Can you reconfigure some of the space that exists for other purposes? How might you think differently of, okay, well, this is our food pantry. It's in this very small closet area, but what else is happening in the larger organization, and how might you partner with others? I see that happen a lot where they say, actually, as you start to think broader about the work, you can access other areas of that space or partner with others. So don't feel limited. It is a common concern, but that shouldn't hold you back from making some of the innovative changes.
Zach had a comment and a question around volunteers. I think it probably goes to the culture, why people volunteer for food banks and food pantries is probably across the board. I don't know if you want to say anything about managing volunteers and orienting volunteers for this kind of paradigm shift.
Yeah, Zach, there's a whole chapter just on volunteers. So there's no way we could do this work if it weren't for the army of volunteers that we have. So it's critical. Yet I think it's one of the reason that I dedicated a whole chapter to it was because it's often part of that scarcity mentality. And as well-meaning as volunteers often are, I think sometimes we structure the days that we're open, the hours that we're open, the way that we distribute food based on the convenience and comfort level of our volunteers, as opposed to the people that we're serving. And that's a hard thing. Like, you have to really have the guts and the leadership to talk about that. And there's so much great work now happening. Feeding America is doing a great job of really promoting, putting the people we serve at the heart of what we do. And if we're serious about that, then it's a matter of like gathering feedback from our guests to find out what days and hours are most convenient for them. How would they like to, have these opportunities? Breaking down those power dynamics is really, really critical. Hours in operation are huge. So typically the food pantries that I see that have the longest lines of people waiting to get food, which feeds into that stigma, that humiliation, the barriers of people not wanting to go. Those types of food pantries are often open the least amount of hours, the least amount of days of the week. So if you're open for 2 hours once a month, chances are you're going to have a lot of people lining up because it's the only 2 hours you're open. You might need to think about recruiting a different group of volunteers for different days or hours of the week. So it is a challenge, but it is something that, again, when you think about the impact that you want to have in the community, it's possible.
I know you talked about earlier, and Nancy's question kind of gets to this, co-locating or trying to do kind of wraparound services in a physical space versus referring to another organization. Thoughts, pros and cons on that if you're just getting started?
Yeah, so if you're in a very small space, I talk about it like many things in the book. I talk about instead of black and white, yes or no, it's along a spectrum and it's a continuum. So if right now you're not offering any referrals to any other services, a really great place to start is, get to know a few other good community organizations that may be helpful for the guests at your food pantry. And then starting there, providing that referral, ideally it's a warm referral. So you can say, hey, do you know about this program that offers utility assistance? They have an application at this website. You can check this out. They're open on these days of the week. That's more of a warm referral. If you have the space, I think creating a more one-stop shopping opportunity, whether that's that you invite folks to come to your location so that they can enroll people there or they can do outreach. In El Paso, a food pantry that I've worked with, they do periodic resource fairs. So, on a monthly or quarterly basis, they will host a resource fair. So on a different time than when their food pantry is open, they will invite several community organizations to come. And it's almost like a job fair. It's a resource fair to highlight the different stuff that you're doing. So and then further along the spectrum, then you can have coaches that are trained to provide more kind of case management services.
Michelle was wondering about urban food pantries. And as I think about that, I also think of, in our area, we're maybe more rural, but in Chicagoland, it's more suburban. Do you see any differences, or what does it look like when you think about these programs, rural, suburban versus kind of an urban setting?
Yeah, Michelle, we had a very similar aha moment at the beginning of COVID. So I've done a lot of my work in the city of Hartford, Connecticut. Hartford is a geographically fairly small city, 17 square miles. And we have over 50 food pantries in a very small, densely populated with very high poverty rates, a lot of generational poverty. So on the surface, it looks like there are plenty of food pantries for the need. At the beginning of COVID, when COVID hit, and many of the volunteers are senior citizens or retirees who could not be available to work in the food pantries, and many of the food pantries that were open, let's say 1 time a month, 2 times a month, and there were many more people who needed food. It became very obvious that having fewer, more strategically placed and full service, I'm using your words here in the chat box, beautifully written, right? That would be way more effective in helping folks. And we can then help identify, these are the core places that are open multiple days a week, as opposed to here are 50 food pantries and you're going to have to try to navigate that. I believe that's often the role of a food bank can play that role. And this is something that we're starting to do now. It's a challenge. It takes leadership, lots of community organizing to bring groups together to say, hey, did you know there's a food pantry that's 2 blocks away that's open on separate weeks? Can we try to consolidate? Can we try to combine efforts to make it better for the people in this community so they don't have to go and navigate that? It looks very different in rural areas where there often are fewer programs available. So strategically looking at where is the need, doing some type of a gap analysis. So many great mapping resources these days, geographic information systems, GIS, all you cool academic researchers out there, there are many, many ways to look at the need and say, where are the gaps in rural areas that need to be addressed? I think in suburban areas, let's not forget about our suburbs, it can look different because often people won't know about social service agencies. So if you are newly divorced, you've recently had a health impact, you've never thought about needing these types of social services, you often don't know where to go. And it's not as obvious as some of our urban centers where there's a lot more outreach that happens. So yeah, I think it looks different in each of these locations.
John kind of got into this a little bit. When we have, especially in rural areas, you might have one food bank or one food pantry that's meant to serve a whole lot of people. So people will come from different counties, traveling an hour to an hour and a half, and yet sometimes the
I'm reading this. It sounds like Alicia might be frozen. Changing hours when most people need help and get, I wonder if this is the right other zone with more limited hours. I'm not sure if that was the question. I love all these questions in the chat box, folks. Keep them coming. Oh, and she's off. Open, you're muted, Alicia.
Oh, sorry. There you go. I was asking about visitors to food banks and food pantries. Sometimes there's a residency requirement, and mainly that's coming from, say, a funder or a government agency, and yet food, there's not a boundary. Have you seen how food pantries or food banks deal with that residency restriction?
Yeah, so typically, I don't typically see those types of restrictions coming from funders. It certainly isn't from government food. In fact, it's kind of the opposite. If you receive government commodity food, typically it needs to be available to folks in the public. But often a food pantry that says, hey, we have limited resources and there are other food pantries in other communities. So we're going to restrict which zip codes, which counties, which towns we serve. Most of them, a best practice is anybody who's coming for food, certainly the first time you offer them food, they're going to leave with food for today, but hopefully you can redirect them and do it in a way that helps to explain why we do this, that, we don't have unlimited resources. So we know here are other programs in your area that may benefit you, but we're not going to be able to help you longer term. I think the more that we can reduce the barriers for people coming, the less what I call proof of poverty. It's unfortunate when I see, and often it comes from a food pantry setting. So like some director or volunteer thought it was important to make sure that they got pay stubs from folks or some proof of residence and documentation of how many people and birth certificates of people coming to the pantry. I always look at it like, if someone is taking the effort to go to seek free food, they need that food. And the less stigmatizing we can make that, the better. Having said that, if you want to do more in-depth outreach and connection to community resources, people may need to provide that information, but you don't want that to be a barrier to come in the door. It should be, hey, if you want to enroll in SNAP or enroll in some other services, you may need to provide that information, but that shouldn't be a limitation to coming and getting the food.
So Dan's with our Dekalb County Community Gardens, and they partner a lot with local growers. Have you seen the use of local food production be engaged in food pantries and food banks?
I think it's wonderful to engage with local growers. I think often at the scale, if you think about scale and volume, it's often best if you have a local grower that's contributing directly to a local food pantry or program, as opposed to a local grower donating to the food bank that then has to sort that and process that and bring it back to the food pantry. This is fresh produce that is perishable. So the quicker in real time you can get it one to the other. So I think making that connection most locally is best. Obviously, if there are larger growers, that can provide at scale, it's nice, like it's wonderful when food banks can take in that and have locally grown produce, supporting local farmers. But yes, and all good.
Yes, and yes. Have you seen, or do you have examples, maybe it's in the book, about ways to measure client health, more of a long-term impact of them accessing better food or more frequently?
Mm-hmm. So we've conducted some research on our swap system. At the client level, we did a survey when a food pantry was about to incorporate swap, and we measured what they were selecting at the food pantry before swap was implemented and after. And after implementation, the guests were selecting more of the green and yellow foods and less of the red foods. So we know there's a ton of research that there is demand for healthy food among food pantry guests and clients. In terms of health outcomes, it takes time to improve health outcomes like type 2 diabetes, like hypertension. I know there are some food banks that have done really great healthcare partnerships. So where and many healthcare providers, healthcare systems are getting engaged with offering food pantries on site. So a hospital-based or clinic-based food pantry is a great location if you think of a clinician can screen patients using a 2-item questionnaire to measure whether they're food insecure, and then if so, refer them to local food pantries or referring them to one in-house, and then providing wraparound nutrition education, health promotion, diabetes prevention strategies. I think that's the kind of intervention that's typically required to see the kind of clinical health outcome changes. It takes that type of intervention. There's some of that data that exists. And I think there's a lot more that we need to look into. There's room for growth, for sure.
And Haley followed that up. How do you maintain an inventory system then to measure swaps? Are you classifying food and then you're measuring how much of these types of food goes out the door? How do you do that?
So what we're doing, so I created SWAP really for the food pantry level, and that's where the acronym Supporting Wellness at Pantries, because from my experience, there wasn't an easy tool for food pantry staff and volunteers to determine the nutritional quality of food. But what's really exciting is that food banks around the country are starting to use SWAP. So when a food bank uses it, they can then track the food in our massive warehouses and our inventory system. So then when the food pantries in our network order from the food bank, they can start to see green, yellow, and red when they're ordering from the food bank. So that is, one step. And we've also, most of this research that I've conducted on SWAP, I do in partnership with the University of Connecticut, the Rudd Center for Food Policy and Obesity, my wonderful colleague, Marlene Schwartz, who's amazing. We've conducted research showing when we at FoodShare started to include that rank in our food bank inventory, our food pantries started ordering more green and less red food. So again, it's that supply and the demand. The client-based survey that I talked about, Marlene had some student researchers who spent time and we measured all of the items. So it's a lot of student labor that goes into that of measuring at the client level. But there's a lot of different opportunities for measuring the impact of it. And what's really cool also is thinking upstream. When we think about nutrition education, so often we focus on at the individual level and how do we teach food pantry guests what they should be eating. And what's exciting through SWAP is we can turn that 180 degrees in the other direction and provide education to our donors to let our food donors know we're using a SWAP system because we are really focused on the health disparities that exist in our communities. So thank you so much for your donations, but we don't really want your chips and your soda as much. We really want you to focus on the green and yellow foods. And then we have metrics to be able to use as benchmarks and to increase the donations of healthy food that come in.
Brian asked earlier, and he's a chef, and wondered about, culinary kind of education and how to cook with the green and yellow, which could be another part of that. Have you seen examples of that?
Yep. And again, Marlene Schwartz, and if you, we've got resources available on some of this, the research that we've conducted on SWAP, but a study that she had done was in a food pantry setting. She compared, I'm going to see if I get this right, comparing a recipe card for one set of time, and then a recipe bundled with the food items. So imagine you go into a grocery store, and instead of just a recipe card, it's like, here's the whole, like, here's the brown rice with the meal kit. And then the third level was the meal kit with a taste sample, like, so where you could actually sample it. And it's really great for some foods that may be less familiar, that you get from the food bank or from government commodity food, but you're like, I don't really know how to use this. The more we can make it convenient and easy for folks, that the meal kit and sampling it. And then I'll add just one other layer. What's really cool is if you can ask food pantry guests, have them share some of their favorite recipes, have them share some of the food items that they like most. And then as a chef, how cool that you can use your culinary skills and knowledge to say, okay, can we tweak that recipe to make it a little bit healthier? Or can we source the food from that recipe that's familiar in our community? Imagine if you're a guest going to a food pantry and they're highlighting your favorite family recipe and the food is available, like just the impact that might have.
Somewhat related kind of in the cultural realm, because I could just imagine culturally there's lots of difference in the types of food that people eat. But also, what are your thoughts around services being offered in different languages and signage and things like that?
Yeah, I mean, I think it's really important. The recent study that we just did statewide here in Connecticut, asking about barriers, we found, not surprisingly, among Hispanic population, it was like a third of them said, that it was difficult to access help because it was, they couldn't understand, they didn't understand, there wasn't signage in Spanish for them. So, how do we increase access to healthy, nutritious food? How do we increase access, reduce barriers? Language barrier is huge. I was talking last night with a really awesome food pantry in Massachusetts. They're called Open Table, and they are recruiting staff members from that speak Portuguese, and they just know like that is critical for them based on their community and their population. And so knowing your population, and some of that, it's just having the conversations and putting up signage. And again, there's so much we can do with Google Translate and other things than, taking some baby steps to provide resources in other languages can be helpful too, even if you can't hire other staff.
Yeah, and I'll give a plug to universities and colleges. If you're not sure of the languages that are spoken in your region or the places where you are, certainly reach out to college and university campuses, and maybe we can do some of that background research for you or help you kind of identify that. Where students love to do those projects, especially if it has that real practical application. And even websites. I mean, I think you can do a lot with Google Translate, but sometimes it's nice to have some other languages displayed in your website or printed materials if anybody's doing printed materials anymore.
Mm-hmm.
Yeah. Any other, I'm trying to think if I got through all of the ones that are in the chat. I know when we had talked earlier via email, how does like the Meals on Wheels program fit into the charitable food system? Kind of a separate program, and often some federal dollars are flowing through the state, and it's really tricky, but how does that fit in?
Yeah, historically, I would say it's just a very different system, right? That people would need to apply. They would need to show verification that they are homebound. It is a federally funded program, et cetera. Gosh, with COVID and all of us being homebound for some stretches of time and so many more people needing delivery, needing at-home services, I am just so impressed with the innovation that's taking place around the country. And Northern Illinois Food Bank is a huge, I just can't speak highly enough of how much they've done to think out of the box of how do we reach people who need help. So, they're different in that it's public versus private, but I think there's clearly a need to support people who can't get out.
Awesome. Haley had a question around when you try to build those relationships. Is that could there be a stigma there? Like, now you know who I am and you know my kids, and like, is that more of a problem, or is actually it's better in the long run?
Yeah, I think it's a really good question. I think it could be, depending on how it's done. I think one thing we've also learned in terms of broadening our thoughts around choice, that many food pantries that I've talked to and food banks that have done research of, do people prefer that kind of drive-through anonymous transaction, or do they want to come back inside, especially pantries that had already been offering choice and more of a shopping model? Do people want to stay in the drive-through or do inside? And it's often been mixed, that it's a mixed bag. Some people are like, I love the convenience and the anonymity. Others say, I miss that relationship. I miss coming in and supporting it. I think you want to be careful. I think it can be stigmatizing if that greeter is not the right personality for it. I have seen well-meaning volunteers that can cause a lot of harm in that they lord over their authority, and can be really rude and demeaning to folks of letting you need to stand in line. Don't do this, don't do that. Like, you want to make sure that if you are designating a greeter, that they're the, a person that's going to do that role and take it well, and knowing about confidentiality, knowing about trauma-informed care. I think there's a lot of good, but also potential harm. You're right.
Definitely comes down to the choice again. So Nancy had put in the chat earlier, and I forgot to come back to it, the 2-item survey that you mentioned. I think it's in the book, right? The 2 questions.
Yeah, and it's
probably on your website. Yeah.
It's probably not on our website. It's called Hunger Vital Signs, and FRAC, the Food Research and Action Center, has some really great resources. If you Google 2-item food security screener, you should see a lot of resources. It's based on the 18-item USDA food security module that was then collapsed down into 2 quick questions that a clinician could ask. And if a person answers yes to either one of those questions or affirmative to either one of those, they would be considered food insecure. Yeah.
I think I found something on the Feeding America site which should get you most of the way there, at least the 2 questions, and probably links to the USDA.
Yeah. One. If you spend a little time Googling it, there's some great stuff on it. And then I think what's exciting is, as we see more healthcare partnerships happening, it's then how can we help support? So we have these easy 2 questions for clinicians to ask. Some of the research has shown that some clinicians are hesitant to use these 2 easy questions because if someone answers affirmatively, they don't know where to refer them. So then that's our role of then partnering with healthcare providers to say, if you screen, then here are good resources. And ideally, back to that earlier question, it's not just a generic list of here are 50 food pantries in the city of Hartford that you can refer to, but rather here are some really strong agencies that are open multiple days a week that are, promoting healthy, nutritious food, so that someone, where if the doctor says, wow, not only are you food insecure, but you're struggling with type 2 diabetes, you should watch what you're eating, we refer them to a food pantry that is chock full with highly processed food that might contribute to their health risk, right? So I think that intentionality of making those connections is really important. So stronger, better referrals than kind of generic broad ones.
I know that Brian put in a link to an upcoming program that their office here at NIU is offering, so you can check that out. Janine was asking about the training of the volunteers in this kind of warm, trauma-informed kind of way. Any resources there that you've seen are useful?
So one great program that I would suggest, it's called Leah's Pantry, L-E-A-H, Leah's Pantry. They're based in California. And I think predominantly they had a lot of trainings and programs specifically for California-based programs, but I think they're broadening some of that. They do really great work, and they're doing more around equity, diversity, inclusion, and trauma-informed care. So that's a nice place to start.
Great, thank you. Shannon just noted that sometimes nutrition education can be seen as an assumption that they might not have access to education around healthy eating, but it might not be. So they were saying in Aurora that they provide recipes that, because it is a time factor, not just the cost, but definitely a time factor.
Yeah.
Awesome. Anyone else? Oh,
I'm
yeah.
just seeing, I saw the one from Isabel. Can you talk about how the client choice model helps uphold dignity for clients? Are there newer models happening? Yes. It's really amazing. And again, this is like pre-COVID, I would describe it as, and many pantries, like the traditional model is the volunteers pre-bag the food, everybody gets the same item. People get to the front of the line or then handed that bag of food that has been determined by a group of volunteers. You could just imagine all the reasons why that might not be beneficial if you think of your own life. Typically, the tipping point for pantries deciding to offer choice, this is interesting. It's when they see the food that they distribute from their food pantry that they very carefully put in the bags, when they have a food drive and their food comes back to them. And the only reason that they know, like, so it's food that is kind of unique. There's a lot of food that we get through food banks and government commodity food that's very specific to charitable food that you wouldn't necessarily see. It's not a Del Monte can of corn that you would see in your grocery store. It's clearly, food bank type food. So the food pantry knows, wow, the food that we are so thoughtfully giving to folks in our community, and they're saying, no thanks, you can have it back. How inefficient that is, and how that just doesn't, we think about food waste, it goes counter to all that. So, and I've just witnessed that it's just that sense of empowerment when even when someone can say no to an item, that's a choice too. So if everybody gets handed the same bag of food, whether or not you need it or want it, it's kind of demoralizing, where it's wasteful in many ways. So when you flip that around and you allow people to choose their food, you allow them to say no to food, you allow them to order it online and pick it up in convenient locations. That's a lot of what I have seen post-COVID. That is just really, really cool stuff that's happening.
Yeah, do you think some of those innovations will continue after?
Oh, yeah.
Things that will stick around? Yeah.
Yeah, I do. Yeah.
Awesome. Ellie asking about what are the various food items that are included in SWAP? Is that listed somewhere that you guys work off of?
All the food items. It's the cool thing with SWAP is it's meant to provide guidelines for any food item. So, and I'll tell you, it's beneficial for food insecure households that are struggling with health disparities, and it's helpful for everybody else too, and it's helpful for our food donors and food providers. If you, the other thing I would suggest is if you Google healthy eating research, or HER nutrition guidelines, you'll see some great resources through Feeding America and through others that really outline, and our SWAP system aligns directly with these HER guidelines. So any food item, whether it's a can of soup, box of cereal, condiments, canned fruits, they're all rankable by swap. It's meant to be all inclusive. So for example, all fresh produce, that's always a green. Desserts are always a red.
Janet was talking about that she would share her nutrition policy if anybody's interested, from Loaves and Fishes in Naperville. So thank you for that.
Yay.
Thank
Yay.
you, thank you. And that's, I guess this is your work in Connecticut, is you have a pretty strong network. My guess is, and this is also that conversation that we're having here, is to be a resource for each other. So I'm glad that people are sharing their resources. And if you have anything that you'd like me to send out when we do the recording and send out the slides, send it to me and I'll make sure it gets included in the resource list as well.
Yeah, that's the really fun part I feel about my work, is through our institute, we're not just working in Connecticut, that we're a resource nationally. And what I tried to do in the book is to highlight examples that are happening all around the country. And it's not just work here in Connecticut. It's certainly not just work that I've been a part of, but there's so much innovation that's happening. And the more that we can learn from one another, share with one another, partner with one another, we're going to be better off. And I love opportunities like this, and through our webinars, I try to highlight the great work that other people are doing, because unfortunately, sometimes within academia and within nonprofits, we have a tendency to compete, and that's just old school. It's not going to help us move forward.
This wasn't necessarily a question I was going to ask, but I was totally curious. So now that I have you, your book was published by Island Press. And you have to tell us about that publisher, because after I read it, I'm like, oh my goodness, it's a nonprofit publisher. That's amazing.
Yeah, it's a pretty cool story. So I'd never written a book before. Most all of my writing had been, I spent a lot of my career in academia. So I've, written academic journal articles where you go through the publishing process. I'd never done anything like this. And I reached out to my friend and colleague, Mark Winnie, who used to run the Hartford food system here in Connecticut. And he is a community food security advocate. He does great work, and he's written a few books, and I asked for his suggestions, and he had been published by Island Press in the past. And he said, you should contact them. I really had no idea in my mind. And, he said, all this stuff is competitive. And usually with writers, you submit proposals to multiple publishers, they all say no, and you just keep going and slogging through. So I really had no idea what that process would be like. I had already been writing for a few months. I had enough under my belt that I had a feeling I knew the audience that I was writing for, what the topics were going to be about, and why I thought it was going to be important. And I submitted the proposal on a Sunday afternoon. It was September of 2019, Sunday afternoon. And Monday morning, Emily Turner at Island Press emailed and said, this sounds really interesting and I want to learn more. I mean, I cried on the spot. But yeah. So they've been amazing to work with. They're really, really cool. They focus primarily on environmental work, but they do publish some food related work, and certainly from an environmental focus. But it's been fun to work with them and have them realize how big this charitable food system is. Because I think one of my initial phone calls with them when they said they were interested is like, so like, tell me how many people might be part of this network. And I tried to explain to them the scope and the size and the scale of this charitable food system. And I think they're still marveling a little bit. The book is doing very well. And I think like it's kind of exceeding their expectations, because usually, and I think this is like how we can all be better advocates at letting folks know the important work that we do. I think when most people think about anti-hunger work, and certainly charitable food work, they think of like a small food pantry in the back of down the basement of a church. And there are many of those programs, but gosh, like we're so much bigger than that.
Collectively, right.
Totally. Yes. Yeah. And then collectively, if we think about the impact that we can have when we harness our goodwill together, when we partner more together, think about the changes that we can make. Think about systemically, we can absolutely change the nature of the charitable food that's donated from the food industry. We can collectively advocate for bigger systems change if we choose to. And I hope we do.
That's wonderful. Thank you, Katie. That's such a great ending to our conversation today. End on a high note, right? End on a positive that everybody is doing so much great work. I want to thank our partners, Dekalb County Community Gardens, Northern Illinois Food Bank, Northern Illinois University, and certainly Katie and all of her work. I will reach out again probably by this afternoon or early tomorrow morning with the recording. Any resources that you would like to send me, you can send it to my email and I'll make sure that it gets distributed to everyone when I send out that email. Any last thoughts, Katie? Or I know that was a perfect wrap up, so you don't think you have to add anything, but if you want to, feel free.
Thank you for the opportunity to be here. And thank you, all of you, for the great work that you do.
Thank you so much, everyone.